Hey everybody, I am here with Dr. Suhyun An at Campbell Health Center. You can find them at campbellmedicalclinic.com. And we're here to talk about ED and some of the common causes and misconceptions with it. So Doctor, thanks so much for joining us today. I really appreciate it.
Thank you very much for having me here today.
Definitely. And I wanted to start off just by asking how long you had been working in the space of men's health and specifically with ED.
I want to say about 4 or 5 years. And it's something that naturally just happened because we do specialize in regenerative medicine, wellness, overall health.
Okay, yeah. So was it just the natural progression of seeing, how big of an issue it was and how many men are suffering with it that got you started with
Uh,
it?
no, I should expand on that. We have been doing PRP therapy or platelet-rich plasma therapy for many years now. And those of you who are not familiar, that is when we take the patient's own blood and harvest the plasma from the patient's own blood and inject it to treat many different conditions. So PRP, we use it literally from head to toe. We use it to do hair restoration, facial rejuvenation. We also use it in every joint, especially back, hip, and lower back and knees, shoulders for different orthopedic injuries or arthritic conditions. We also use PRP to treat nerve order disorders like peripheral nerve injury or peripheral neuropathy. And I was introduced to Dr. Charles Runnels, who basically came up with another application of those PRP, and that is the injection of the patient's plasma into the penis to help with the ED, erectile dysfunction, or it can also help enlarge the size a little bit as well too, basically rejuvenate that part of the body. So since we've been doing it for many years using plasma therapy, it was just kind of natural progression of like, why
Yeah.
not offer that too? We're already doing it. We'll just be injecting different part of the body.
Okay, yeah, that's awesome. So you guys already had the experience with it and knew, exactly what it could do. And so yeah, that's great that that got you into it.
Yeah, exactly.
And why do you feel like it is that, a lot of guys are kind of, nervous about bringing it up and they don't, it seems like one of the things that they just mention, with their primary care doctor, if they're just trying to get, Viagra or something like that, it seems like they feel like that's the only options for them and they don't know that there's these alternate therapies out there.
Um, so number one, yes, men do feel embarrassed to discuss it. And when they do discuss it, usually it's going to be their primary care doctor or family physician, as you mentioned, and that always ends up with discussions of Cialis or Viagra. Um, we get a lot of men who's tried those things, and generally we hear a lot, it worked great at first, but it's not working as good as it used to be. Okay, so a lot of men like don't know where to go to after that. And also consider 80% of Americans are overweight, 80% of men are overweight, and also what follows that would be your cardiovascular conditions like hypertensions. And if you have those hypertensive or cardiovascular issue, you should not be taking those medications. And alarmingly, we have men who says, I don't care, and continue on these taking Viagra, Cialis, really subjecting themselves to a higher chance of getting a heart attack or stroke, which is very dangerous. As far as men not feeling comfortable discussing it, I mean that's only natural, right? Because not only a part of their body is not working, it can hurt their confidence greatly. And keeping a relationship going with their girlfriend or their wives, it ends up affecting their relationship as well too. So what we have done is created a comfortable environment just from that, even that first phone call. We make sure that you're in a private environment where you can comfortably discuss that with our new patient coordinator to make sure that they really feel comfortable. Once you're in the clinic as well too, we make that very discreet environment where they can feel comfortably talking about it. My philosophy is that because we do treat a lot of orthopedic conditions like knee pain, ankle pain, back pain, and neuropathy, it doesn't matter whether it's your knee or your feet or your hand. If a digit in your body does not work the way it should, you should, number one, not only be able to comfortably talking about it with a professional, but you should want to do something about it. There's nothing, in that sense, there is nothing unusual or abnormal about it, right? Because as we get older or due to environmental factors, things do happen. And there are now many more alternatives other than pharmaceuticals such as Viagra and Cialis.
Yeah, definitely. That's a great point. And I think, it's really important too for men to be able to talk about it openly, because for you as the provider, you need to know exactly what's going on, how bad is the issue, and figure out, what's causing it, and what can we do to fix it.
So as far as what we offer in the clinic, so we started out with the P shot, or the platelet-rich plasma therapy for the penis injection. It sounds painful, but it's actually quite painless, because the very first injection that we're going to do is a numbing injection, very much like getting a numbing shot on your gum before a dentist start doing the work. So I always tell the patient this is the worst part, because once after the initial numbing injection, I mean, you're not going to be able to feel anything because we use anesthetics. Okay. So we do plasma injection. We also make sure to check the patient's testosterone level as well, because it is the men's hormone that correlates to, sexual performance. Once the patient is determined to have a lower testosterone level or suboptimal level, we may also recommend supplemental testosterone therapy as well too. And that can be in forms of slow releasing pellet insertion, or it could be a injection form as well too. We also brought in a medical acoustic wave therapy that can break off the blockage in the arteries and veins that prevents the blood flow to the penis area. That can break off. We call it almost like a rotor rooster for the pipes that promotes the blood flow to the area. The latest that we have been doing quite successfully is also the Botox injection into the penis as well. The most commonly asked question is, am I going to get a stiffy, like a really Botoxed forehead, like all the time? Right. The answer is no. It's not going to make your penis stiff like a really Botox forehead. What it does is relaxes that smooth muscle, in turn, again, help circulation and the blood flow better when the time for the men to engage in action. So many different options, as you mentioned. Cialis or Viagra is not the only thing now. Acoustic wave therapy, testosterone therapy, plasma injection or P shot, or Botox injection into penis. And if you want to level up it more notch, we also can inject stem cell injection into the penis as well. And that has been all very, very successful with our patients.
Yeah, that's great to hear. And is there anything in particular that would tell you that a patient's going to respond better to the P shot or the acoustic wave therapy, or, the Botox? Obviously, if they have low testosterone, you want to fix that. But for those
Right.
specifically, is there something that would let you know?
I do know that patients or men who don't have a lot of pre-existing condition, like the patient is healthier than other patient to start with, of course, we're going to get better results with that. And what I mean by that is, the abdominal fat and metabolic conditions, abdominal fat, metabolic condition, sedentary lifestyle, and diabetes are really detrimental for erectile dysfunction. I mean, it is one of the cause of erectile dysfunction. So if the patient comes in and they don't have this condition, I know for a fact that we'll get a much better outcome with these patients, but we may sometimes have to do a deeper dive with the patient. They have abdominal weight, the hip to waist ratio is, a lot bigger. Then we do need to do a deeper dive with the patient and let him know, let's kick up your activity level and see if we can help you, put you on the weight loss program at the same time. There was an interesting study that I read recently, and that is men who logs in less than 6,000 steps a day, they have a greatly reduced testosterone level. There was almost a direct correlation between that. So it is totally worth it to invest in Apple Watch or, Fitbit that can count the number of steps that, you take, and just make sure that you're logging in more than 6,000 steps per day. So to answer your question, yes, absolutely. When we review the patient's history, we can see we're going to have much better results, or we may need to do a little deeper dive and put him on a lifestyle program or help him lose weight or improve diabetes and etc.
Right, definitely. Yeah, because the ED is really just a symptom of overall, declining health, right?
Yeah, exactly. And another thing that I believe is almost my duty to mention is environmental toxicity. And if I can single out that one toxin that really affects testosterone level and fertility in return, would be the BPA, or bisphenol A, which is contained in most plastic products. So I always recommend patients to stop drinking plastic water. It's nothing more than often just the filtered municipal water. Not to mention the plastic itself contributes to the, just the waste landfill in the oceans. But the bisphenol A, or BPA, has been well documented, well studied, has a direct impact on sperm count. And perhaps that is the reason why we're seeing worldwide decline in sperm count. Almost, that number has been halved in the last 40 years worldwide. And it's affecting, EDs, not just sexual performance, but something like 1 in every 6 couple is suffering from infertility. They can't conceive, or they can't get pregnant. So if I may give our audience one message, is stop drinking from plastic water, remove all plastic containers from your kitchen, because especially these plastics that's gone through the wash and clean cycle in a dishwasher, over time you start leaching more and more of it. So when you put food in it, when you store especially hot food in it, you're actually ingesting food and, BPA along with it. In return, disrupts your hormone and causes ED, infertility, and diabetes, and all kinds of other problems as well.
Yeah, that's a great point. There's, obviously some convenience there, but I don't think the risk reward is really worth it at all. Are the plastics that say BPA free better, or do you feel like those still contribute to it?
I just don't trust it.
Yeah.
Even if it says BPA, I mean, really, God knows what else. I just don't trust it. So my kitchen is mostly plastic free. I drink or buy a bottle of water if I really just have to. But if the store has alternatives like glass packaged water, even though it may be a little more expensive, I go for glass bottles versus plastic bottles.
Definitely. Yeah, that makes sense.
Yeah.
And with the acoustic wave therapy and the P-shot, do you usually recommend those treatments in conjunction with each other, or is it usually one or the other for patients?
Well, it depends the extent of the patient's ED. We do have the patients take the what's called SHIM score, which is a ED scoring system and a screening questionnaire. So depending on that, the patient's age and the background, we may recommend both, or we may recommend them separately. Both P-shot and the acoustic wave could also be used as a maintenance once a month or every other twice a month, depending again the patient's condition and the background. Yeah, so
Yeah, have you seen pretty good results with using those, when you compare when you do before and afters with that?
oh yes, absolutely. Again, a lot of men, even we're treating them, still feel a little more embarrassed about it. But the feedback we get is, oh, my wife definitely notices it.
Right.
My girlfriend definitely notices it. Something is different. Often they don't even tell their partner that they are getting these treatment. So it really makes us very happy to get those kind of feedback.
Yeah, yeah, definitely. That's good to hear. And is there any, side effects or anything to those or reasons why they might not be a good fit for it? I know that's a big concern with patients that have tried the PD5 inhibitors, is the side effects that they might get from it.
Uh-huh. So for P-shot, and any type of injection, anytime we're piercing the patient's skin, there's always a risk of infection, right? But we practice sterile techniques. I mean, we, do this injections following a guideline and protocol. We have done hundreds of these injections and we've never had those infection. Okay. So, but that's something to remember. Anytime we're piercing the patient's skin, there's always the risk of the infection. And of course, if the patient has any kind of blood-borne disorder, blood infection, cancer that's been inactive less than 5 years, those are what we would categorize as a automatic disqualifier. We wouldn't even recommend that we use your own plasma. Okay, we
Right.
may actually end up using donated tissues such as amniotic fluid or exosomes or cord tissues. As far as the acoustic wave goes, I know that for patients that have any kind of like a pacemaker or pulse generating electrical devices in their heart, we can't go like near in the upper extremity. So that's okay for us to treat the waist down below penile area or feet or ankle or knees. So those are some of the most common contraindication that I can immediately think of that will prevent the patients from seeking this type of treatment.
Yeah, that makes sense. And one thing you mentioned too was maintenance treatments. Is that something that you do standard or is that something that's just on an as needed basis?
I want to say more as needed basis, but it's almost like the patients want it more than we recommend it to them. They, by the end of the care, before we do the final exam or questionnaire, they say like, okay, what's after now? Because I want to continue to be this way and not wait until it goes back before I got the treatment. So it can also be determined largely by the patient's budget as well too. So we look at what they feel comfortable with, what was the outcome of the treatment that we've done. Again, it's not like a cookie cutter, one protocol everyone gets. It depends on the patient's situation and their outcome.
Yeah, that makes sense. And I would imagine too, that being able to make those lifestyle changes too would definitely help them get, continued benefits from it.
Yes, absolutely. So we, in any condition that we treat, like it is not our goal to have you come back to us like so often,
Right.
right? So we want to give them a new habit, a new lifestyle. And it could be something as small as not drinking bottled water and, saying no to the meal or put them on an intermittent fasting, right? Improving their diabetes, it's those kind of things are not something that you just do once and not do.
Right, right.
It's a consistency is the key, right? And now it becomes part of your life and that's just how you are.
Definitely. Yeah, that makes sense. And I think for, a lot of guys, I'm sure even after doing the treatments too, that they would realize that it's well worth, changing those habits and making sure that they do things that don't cause the ED to come back again.
Yes, absolutely. Yeah.
And is there, a benefit to coming in early and getting treatment versus, just waiting? Is it typically get worse the longer that they wait?
Well, I think I can say that things like ED and really any disease could be considered a degenerative condition. And by definition, it means the longer you have it, the more it deteriorates.
Right.
So I think any illness, disease, dysfunction, if caught early and done something about early, will have a much wildly successful outcome. And I mean, just think about the worst thing that you can have, cancer. I mean, early detection and prevention and treatment can literally be a matter of life and death, right? So I think the same concept could be applied to erectile dysfunction as well. I attended a conference about 2, 3 months ago, and statistically, about men starts developing signs of reduced sexual function or ED 20% starting in their 20s. And every decade, that's another 20. So by the time you're 40, 50, 60, we're talking 60, 80% reduction in their sexual performance. So it's so common. People don't feel good about it and don't want to talk about it. I think the doctors themselves are uncomfortable talking about it in many situations. So, but do something about it. It's okay. Everybody, it's very prevalent, and there are things that can be done other than just pharmaceuticals.
Yeah, that's a great point. And so, should they seek professional help and try to find these treatments whenever they start to see a consistent decline in function?
Absolutely, absolutely. It wasn't some of the uh I think the first thing that happens is the loss of spontaneity, before I was able to do it, but now it takes a little more. It takes a little longer. It takes a little more. I mean, those are like your body trying to tell you something, right? So of course it's going to be best to do something about it before it gets to be worse. Now it lost the spontaneity, and now it really needs to. It just doesn't work, or it's not intense as it used to be. You know, yeah, so all those things, I think they should pay attention definitely, and do something about it, get evaluated before it gets any worse.
Yeah, I definitely agree. And what would be the best way for patients to get in contact with you guys at your practice?
That would be our website, which is campbellhealthcenters.com. So it's I had to put an S on it because there's Campbell Health Center that is like some college, university, like a student health center. So it's campbellhealthcenters.com. They can always call us at 832-402-6911. And our agents are trained to have this conversation discreetly, and make the men feel comfortable.
Oh, that's great. Yeah, that's really good to hear. I think that'll definitely help guys feel a lot more comfortable about reaching out
Mhm.
and help with this. That's good to hear.
And we only have female providers, myself and my PA, who performs most of these procedures. So I think men will feel more comfortable about that as well too. We get that a lot, that we came to you because you're female. I don't want another men. We get that quite frequently. So
Yeah, well, cool. Yeah, I love the work you guys are doing there, and I appreciate you talking with us. Was there any last advice or anything you wanted to leave the patients with if they're struggling with ED and just not sure what to do?
I think I've discussed everything that I want to I want my men to know. And environmental changes, being more active, working on reducing that abdominal fat, and not just the organ itself. Many contributing factor. Most illnesses, especially chronic illness, are what's called multifactorial, meaning there's more than one thing that contributes to the problem. And sometimes it's not as simple, but we have many treatment and ways to address the root cause of the issue. So feel comfortable, discuss it, do something about it before you start really damaging not just your physical well-being but mental well-being as well too.
Yeah, yeah, definitely. I think that's great advice.
Hmm.
All right, great. Well, yeah, like I said, love the work you guys are doing, and thank you so much for taking the time to talk with us today and share the education on that. I really appreciate it.
All right, thank you very much for having me today.
Yeah, of course. Have a good rest of your day. Thank you.
All right, bye-bye.